My name is Tamara Lutfi. I'm the coordinator for the Global Evidence Synthesis Initiative, GESI, Secretariat at the American University of Beirut. I'm very happy to introduce our key partners in the humanitarian field who will tell us about their use of evidence in their fields.
Hi, my name is Hassan Ismail. I'm a humanitarian learning specialist. I used to work with the Lebanese Red Cross, specifically in planning, monitoring, evaluation, and learning. Then I got more into the evidence part of the humanitarian field. The reason for that is that I always found that there's a gap between what's being implemented on field, what we attend in conferences, and what academia or what's being published online. That's why I decided that I want to be the link between these two partners, and I started supporting the Global Evidence Synthesis Initiative with different humanitarian projects. I believe that evidence, especially within the humanitarian field, is very important. We have to measure whether our services or whatever we're offering to the right holders is actually effective, whether it's efficient, so that we can ensure the accountability to the people we're serving. That's why I believe and I encourage all humanitarian practitioners to get more into humanitarian evidence, to know and to learn more about the methodologies such as the systematic reviews or maybe scoping reviews that they can use in order to take better strategic decisions in their organizations or when planning any interventions.
Quality guru Sir Edward Deming once said, "Without data, you're just another person with an opinion." My name is Shawi Aminuddin. I'm a volunteer at the Lebanese Red Cross Emergency Medical Services since 2007, and I currently work in the Quality Improvement Project at the Lebanese Red Cross. The emergency medical services of the Lebanese Red Cross are considered the primary pre-hospital healthcare providers in Lebanon. And in 2016, LRC has taken the decision in order to change its approach from an experience-based approach into an evidence-based approach, in an attempt to improve the effectiveness of our services, to decrease our response time, to measure our performance and implement changes and QI initiatives, quality improvement initiatives, based on that. In order to do that, the Lebanese Red Cross had to draft clinical guidelines and policies and procedures. It had also to implement patient care report and analyze patient care report and dispatch times in order to measure its performance. The job wasn't an easy one, mainly due to the lack of availability of evidence and due to the low quality of evidence that's present in pre-hospital setting and in pre-hospital research. Following drafting the clinical guidelines and policies and procedures, these were approved by the medical directors. LRC still believes in using evidence-based approach and will be doing everything it can in order to implement this project. At the end of the day, it takes a system to save a life, not any system, but one that relies on solid evidence.